Welcome back to the show. In today's Ask the Expert, we're taking your plastic surgery questions this morning for Dr. Stephen Davis, popular plastic surgeon in Cherry Hill. Thank you for coming in this morning.
It's nice to be here.
Well, let's get right to our first question. Take a listen.
I was just wondering if those face creams that they sell over the counter really do work for taking away lines off your face, or whether you have to resort to plastic surgery.
So what
to
area
achieve it.
are you most concerned about?
Right here, the lines here, and of course under my eyes.
Well, let's answer that last part of the question first.
Okay.
Plastic surgery is not the only way to fix that. Skincare products really do work. The challenge is to try to figure out which ones work and which ones just kind of make your skin feel good.
Okay.
We know scientifically that vitamin A and vitamin C type products cause our body's dermis to thicken. So if you apply it to lines around the eyes or around the mouth, it really will thicken and make those lines go away. The two things are, you have to make sure it really is a product that's delivering that vitamin C or vitamin A to the skin.
Okay.
And you got to stick with it. Because a lot of people don't see a result after a couple of days and they go, I guess this isn't working. So you really should check with the plastic surgeon and your dermatologist to find out which ones work and specifically for which ones will work for you.
Sounds good. Let's go right to the second question. Take a listen.
Is there any plastic surgery solution for acne scars?
Absolutely. Plastic surgery is actually one of the only things that are really going to fix difficult acne scars. It's been around for a long time to fix those things. Once again, a good skincare regimen to prevent active acne is number one, and then right after that, to try to use different kind of laser procedures or even little plastic surgery tricks to take deep acne grooves or ice pick type scars out. Plastic surgery is probably the only way to really make it work.
That's interesting because I wonder how that really, because it's so deep sometimes.
It's true, and it really becomes almost like you're sanding the skin or trying to make the cobblestoning go away, and then you may need to fill it from below to kind of even it out a little more.
Interesting. All righty. Well, we have time for one more question. There's a new lip implant procedure called Fulfill. Tell us about that.
It's really exciting what's going on with just all facial fillers and things in general, but most of the facial fillers nowadays require repeated type injections. So even though they may last 6 months to a year or maybe a little longer, you have to come back and get it done. This product is kind of like a filler material that's an implant for the lip. So it's almost like a breast implant kind of thing.
Except for the lip?
For the lip.
So do you put it in and blow it up?
It's true.
Are you serious?
Yeah, I am. It's an interesting procedure. It's not for everybody, but it is something that's going to last longer. And it's going to be a little bit more of a downtime, a little bit more of a surgical type procedure, but some people may like that.
And doctor, does it stay in the lip?
It does stay in the lip. You put it right on top of where the deep dermis and the muscle kind of meet, and you kind of thread it through and blow it up. It's probably not for someone that never had anything done before to their lips. It's for somebody that's had some injections and wants something more permanent.
Well, Clayton did mention to me earlier. Clayton, do you want... There you go.
Well, he had it done.
There you go.
He had it
How
done.
you feeling?
It's still a little puffy. But, yeah,
he looks good.
I think it looks natural.
No, I'm sure it looks a lot better.
Nuts. You're such nuts.
All right, thank you guys. We appreciate it. Doc, we're just kidding around. All right, let's